It's quite humbling to be in Sanders Theater and to think of the history of Charles Sanders. So he was a Harvard alumni, and he left a significant bequest to build this memorial hall that is in honor of Harvard alumni who fought for the Union in the Civil War. So it's very humbling, and I'm grateful to be here and to follow in such wonderful footsteps, including Lieutenant General Smith, Secretary Santiago, Captain Bonvie, and I'm really grateful to be able to talk about warriors healing and spirituality in combat PTSD. So I want to start by talking about some events that happened during the First World War. I'm referring, of course, to the first recorded World War, the Battle of Kadesh in 1274 BCE. This is the first large-scale recorded battle between Egypt with Ramesses the Great and the Hittites, Muwatalli II in modern-era Syria. The Battle of Kadesh is sometimes called the First World War, as it featured one of the largest chariot battles in history. It's one of the earliest recorded military engagements detailed primarily from the Egyptian standpoint. There's a lot on this, and they have translated it as well. There is some from the Hittites as well. This is from a period when pharaohs were seen as divine rulers. They embodied gods such as Amun-Ra and ruling by divine right. Battle was framed as a sacred duty, and Ramses II was depicted as a warrior who was blessed by the gods. If you think about this, this is 3,300 years ago. So this is a very old concept of the intersection between spirituality and combat. Spirituality reinforced the soldier's courage and resilience in war. And there are parallels to modern combat, the divine within warfare and moral injury. Ramses the Great also named his 4 primary military divisions after major Egyptian gods: Amun, Ra, Ptah, and Sutek. These divine names were not just symbolic, but meant to invoke divine favor and deep connection. One of the history's largest chariot battles, involving thousands upon thousands of charioteers between both Egypt and the Hittites. Egyptian sources claim victory, but they were the ones that wrote it down. It was more likely a draw based on what we know these days. Their rule, however, was justified through divine right, and military conquests were framed as sacred missions. War inscriptions and temple reliefs depict Ramses II single-handedly defeating the enemy, reinforcing his divine warrior status. And if you look how much larger he is from the rest of those in battle. This concept of leaders being divinely sanctioned in warfare is echoed throughout history and modern combat narratives. Turning to Peter Paul Rubens, we have Achilles slaying Hector. And if you notice, there are putti and also divine elements within the picture. The Trojan War happened between 12th and 11th century BC. There's a part of myth and history that's involved. We do know that some of it actually truly happened, but we know that there's an invocation of Greek gods, including Athena, Zeus, and the fight for Troy. And you notice Achilles' rage and grief and moral injury can parallel some of modern moral injury and combat PTSD. The Iliad, which comes from several centuries later in 8th century BC, is an epic of war, fate, and the gods. moral injury and PTSD as a theme, you notice that Achilles was haunted by grief, by vengeance, and the God's will. His struggle mirrors what can be seen in today's service members and veterans who are suffering from PTSD. General Hammond talked about the legacy of Harvard and revolutionary change. If you fast forward to the Revolutionary War, John Trumbull served in the American Revolutionary War, and he was an officer of the Continental Army, and later became the painter of the Revolution. He served as an aide-in-camp to General George Washington, and here we see his depiction of General Joseph Warren's death on June 17th, 1775. General Warren was a physician, a patriot leader, and a major general in the Massachusetts militia during the Revolutionary War. And he was educated at Harvard College, class of 1759. Sorry, this is pretty emotional. Just like thinking about being here and talking about this here with you is really just awesome. General Warren was a physician, and he chose to fight as a private soldier despite his rank. And what we see here is his succumbing to the injuries from the British troops. What we see portrayed here highlights the theme of sacrifice, heroism, and the human cost of war. If you turn to the Warren family medical legacy, his brother, Dr. John Warren, was a surgeon in the Continental Army during the Revolutionary War, and he founded Harvard Medical School in 1782. His brother, Dr. John Warren, his son, General Warren's nephew, Dr. John Collins Warren, was the co-founder of Massachusetts General Hospital in 1811. Of note, just several weeks after this battle, General Washington established the Chaplain Corps, and it was just a mere weeks after this event on Bunker's Hill, on July 29th, 1775. His quotes at the time about chaplaincy in the Corps: "We need chaplains. Of all the dispositions and habits which lead to political prosperity, religion and morality are indispensable supports." We turn to a fateful Christmas night, December 25th, 1776. Washington's daring Christmas night crossing was a surprise attack on Hessian forces in Trenton, New Jersey. Washington used the strategic use of this holiday for tactical advantage. This turning point in the success of the attack provided morale boosting to the Continental Army. Emanuel Lezi's iconic painting symbolizes the resilience in its iconic form, although they were probably a lot colder than what this portrays. So on this fateful night, General Washington led approximately 2,500 Continental Army troops across the icy Delaware River. This bold maneuver aimed to surprise the Hessian mercenaries stationed in Trenton, who were allied with British forces. This surprise attack resulted in a significant victory and revitalized the morale, providing a pivotal moment within the revolutionary call to action and to freedom. Fast forward to current modern day, thinking of what has happened in America since 9/11 and the war at home base, what we're trying to accomplish through addressing all of these invisible and visible wounds is a result of this war on terror. I was actually in New York on 9/11. I saw it happen in real time. and speaking to some things that I've witnessed and how it's impacted me. It's good to be here and to be a part of this discussion. Shortly after arriving at home base, I actually met a lieutenant commander with MARSOC, and he was a chaplain, and we discussed the preservation of force and family, the focus on spiritual fitness through comprehensive operational stress control models. This model looks at different levels of spiritual fitness to include being fit, resilient, mentally prepared, stressed, with beginning signs of stress impacting health and readiness, to depleted and strained. Challenges in traditional PTSD treatments have led to an increased acceptance of spiritual healing techniques, but these are not new. If you think of what I've just talked about throughout the millennia, this is foundational. Spirituality can be thought of as describing the way that individuals express meaning and purpose, connectedness to self, others, nature, and the sacred. It's often useful to think of, there's a psychedelic framework called SIRT, which is spirituality, existentialism, religion, and theology. So if you think of spirituality, that might be your own personal inward beliefs, whereas religiosity or religion oftentimes means a connection with others and actually attending religious services. There is some evidence that there is a difference between those who practice spirituality and those that attend services regularly, like Dr. Koenig said. Last year, after discussion with this MARSOC chaplain, this sparked an exploration in me on spirituality and combat PTSD. Home base, as you've heard, has integrated resiliency training, yoga, mindfulness, and acupuncture. With this, I decided to lead a scoping review looking at the interconnectivity between warriors' healing and the spirituality that they have and the impact of all of this on combat PTSD. This is the first time that I'm actually presenting this data, so I'm very happy to be presenting some of the preliminary findings of this review that's in process. So I'm systematically looking at the quantitative data, like Dr. Koenig, that examines this interconnectivity between spirituality, PTSD, and healing, exploring faith, moral injury, post-traumatic growth, and mental health outcomes, while also looking at the social determinants of health and adverse childhood experiences, and recognizing how these broader life experiences impact PTSD recovery, both positive and negative, because we do know that some people have their own challenges related to their spiritual or religious beliefs from childhood. So how do we prompt growth in those who might be suffering from things that happened to them as a child? And so really figuring out, well, what is this bidirectional impact, and how can we promote change within this? So turning to the preliminary findings, we found 59 studies from 2004 to 2024 that met the inclusion criteria. There were 2 studies based on what Captain Bonvie was saying, of unmanned aerial vehicles or drones and the impact on their own moral injury and the development of PTSD and spirituality within that through the Air Force. 73% were cross-sectional studies, which suggest a predominance of observational research. 10% were cohort studies, and 8.5% were randomized controlled interventions. I will note that 1/4 of all of these 59 studies were authored or co-authored by Dr. Koenig. The research primarily focused on US veterans with a limited global representation from Bosnia and Herzegovina, Canada, Croatia, Iran, Mexico, and Sri Lanka. The key takeaway is that while evidence supports spirituality's role in PTSD recovery, more interventional studies are needed to assess the clinical applications and treatment efficacy. So turning to the commonly used measures that we found the combat exposure scale, moral injury symptom scale, which was mentioned by Dr. Wortham, scales for PTSD, spirituality, and post-traumatic growth. The combat exposure scale was the most commonly used measure in the review, appearing in 13.5% of the studies. This is primarily used for assessing military trauma by measuring the intensity and frequency of combat-related stressors, and it's particularly useful for understanding direct exposures to violence, which is critical in examining the immediate impact of combat on mental health. Turning to moral injury, I really would love to thank Dr. Wortham for her work with the DSM and getting moral injury as a Z code. It's a first and vital step on evaluating moral injury and potential interventions for specifically moral injury and not PTSD. Because what we do see, people who come through our programs have significant improvement and they're much better, but they still have some symptoms. Is it possible that addressing morally injurious events in their lives could actually lead to improvements in how they're doing? This is a key measure for moral injury, is the moral injury symptom scale, which is featured in only 10% of the studies, but that being said, there's more work to be done. It's particularly effective in capturing the emotional and psychological distress that service members experience when they perceive they have violated their own moral or ethic beliefs, often in combat situations. Turning to PTSD and the spirituality, the PCL in all of its versions were accounted for 64.5% of all PTSD assessments. The PCL-5 was the predominant measure in almost 1/3 of studies, followed by the other PTSD checklist versions. Spirituality-related scales included brief RCOPE and the belief into action scale, again, authored by Dr. Koenig, and also the Duke University Religion Index, again, developed by Dr. Koenig. These are both used to measure active religious commitment and a widely used tool in assessing religious involvement as well. One of the most interesting studies that I found, and is really a call to action, is looking at post-traumatic growth, like Dr. Bonvie said, and PTSD symptom severity. If you look, this is an inverted U curve, and this study by Kang and colleagues that came out this past year looks at the symptoms of severe PTSD are associated with less post-traumatic growth. And then also when people get better, there's less post-traumatic growth. So moderate PTSD severity correlates with the highest levels of post-traumatic growth. So if you look and think of how people come into treatment when they're hurt or when they are injured, when they come into home base, oftentimes their PTSD scales are off the chart. But when they leave, they're much more mild. So really the intervention point I'm going to suggest needs to be within our intensive clinical program while they're going through this rapid change of 70 hours of mass therapy to get better. This association suggests an ideal opportunity for an intervention when PTSD symptoms are elevated but not extreme. So what we really need to look at is how do we design interventions targeting spirituality and moral injury during the intensive clinical program, capitalizing on the potential for significant post-traumatic growth while they're in our program. It isn't just about treating mental illness. Positive psychiatry is a relatively new concept in the past 10 years that focuses not on mental illness So if you think about what we've been talking about, for most of the morning, we've been talking about exposures rather than diagnoses. Some people latch on to symptoms or diagnoses rather than the thought that they could potentially get better. And hope is a really important thing to capture and grab onto. Healing is not just about overcoming trauma. It's about building resilience, wisdom, and well-being. Positive psychiatry shines a light on the strengths within every patient and provider, I would argue, and guiding them to flourishing. Our next mission really is to join together to look at different interventions, whether that's mindful self-compassion or other spiritual interventions, and that we need to measure ACEs. We need to look at moral injury, and we need to look at post-traumatic growth and integrate this within our programs. Together, through this collaboration with leaders in spirituality, moral injury, and flourishing, as well as medicine and mental health, we're continuing to shape the future where healing is holistic, inclusive, and enduring. Thank you. We have time for questions.
Thank you for a wonderful presentation. My question is about, I'm studying HMOT therapy, hyperbaric oxygen therapy, and a lot of the people I read say that PTSD, TBI is just brain injury and brain tissue damage. When can we know when to include spirituality as part of healing versus a more clinical modality?
That's a great question. Well, I wouldn't necessarily think of them as mutually exclusive, but I think that really the discussion needs to be what are people's interests as well too. So there are many different pillars, whether that's within SOCOM, with the different types of fitness. Spiritual fitness is just one of them. I think that neuromodulation as well as other interventions, whether that's acupuncture, yoga, healing, are all open for potential interventions with anyone. And it really is based on also asking, because if we don't ask about it, how can we know what someone is thinking or what their challenges are? So really it requires having a discussion with each individual person and to tailor a specific intervention to that person in a personalized way. Other questions? Okay, thank you.